Hi, Chad.
Hi, Renee. How are you?
Doing all right. How are you?
Doing well. So far, so good. Looks like somebody has a new rug. No?
No, not new.
Oh,
You're
haven't
just
noticed.
particularly observant today, I guess.
I guess so. There you go.
Gonna need a new rug if this little jerk keeps pulling threads out of it.
Yeah, my dogs do that too. That
Do they?
bath mat. My big male dog destroys
Yes.
bath mats.
The bath mat. Oh my God, he loves it.
He likes to grab the little binding on the edge and just pull it all off. And then he just kind of plucks all the little fibers out like he's pulling.
It's like reverse crafting.
Exactly. He's just undoing someone else's handiwork. Some little poor Indonesian child that was sweatshopping to make my bath mat.
Right. I always pick up more when I go to IKEA, though, so that's where mine all come from.
If only we could get there now. Well, I guess you can go somewhere stateside, but
Baltimore.
oh, really? Well, see, I was always going to the Toronto IKEA and kind of put a damper on that.
I prefer the Hamilton IKEA.
Oh, yeah, I guess
it's a little closer.
Yeah, I guess that's true.
Not as crowded.
Yeah, and pretty good food.
Yeah, right? Oh my God. They're Swedish meatballs back when I ate meatballs.
Exactly. How many places can you get meatballs? All right, it's 12:15. We'll give everybody another minute. Still got a fairly light group. Everyone likes to log on about 12:16, so give everybody their minute. All right, well, it looks like we are at somewhat cruising altitude, so why don't we go ahead and get started rather than make everybody hang around. So welcome, everybody. Thanks for joining. Hope everyone's had a lovely couple of weeks since we last met. I would say it was a lovely spring day, but since it's snowing, that makes it difficult to say that. Then tomorrow's going to be 60 again, so welcome to Rochester. So a few things to get through today, much like always, mainly around vaccine discussion. So we'll kind of go ahead and jump in. No surprise to most, we are on a little bit of an upward climb. Everyone is being hesitant to call it another surge at this moment. But interestingly, the climb appears to be a lot more local than it is national. Some of the hotbeds around the country have started to plateau or even cool. Michigan obviously has been on kind of an accelerated pace now for about a week or two. And New York was trending upwards, but on the whole, the state is trending down. But the Finger Lakes region has kind of plateaued, or certain areas of the Finger Lakes, Western New York, are going up. And as you can see towards the bottom of the page, Monroe County is one of those areas that seems to be going up, whereas interestingly, some of the southern tier counties are a bit more flat as of recent last week or two. So on the whole, the predominant or prevailing variant that's getting subtyped now is the UK variant. So that is the most prevalent subtype of the COVID-19 virus that is going around throughout the entire country. It does make up about slightly over 50% of the Western New York variants as well. So that is kind of our ongoing State of the Union. We still have none that I'm aware of the Brazilian or South American variant in the Rochester area. I think they may have had one in Erie, one or two in Erie, if I'm not mistaken. But we still seem to be somewhat in a bubble in regards to that particular variant. And we'll talk a little bit more about that in a moment after the Israeli study got published earlier in the week and has people in a little bit of a tizzy, probably unnecessarily so. So I'll circle back to that. It'll keep you tantalized and wanting to hang around to hear more about Brazilian variants. So for the meantime, we seem to be kind of treading water at the moment. It is generally true that while we have seen an increase in hospitalization, that is a predominantly younger category of patients. Although the ICU the ICU status has gone up, we are not seeing the same mortality, the same duration of hospitalization, or the same severity of illness. And a lot of that may be because it is a younger crowd. Despite all reports, we are still not seeing if any, evidence of post-vaccination moderate to severe infection. We have heard of a couple that are, have pneumonia who are at home. There's some question as to whether those are still within that couple of weeks after they got their last dose of their vaccine. But we have not seen any ICU level admissions of post-vaccinated people that I am aware of at this point. And certainly not of those who are employees that have been tracked fairly closely through the U of R program. So that's good. I did add at the bottom down here, we are now at 46% of the population of Monroe County that has received at least one dose of the vaccine. We are above 20% across the 10-county Finger Lakes region at this point, but we are still lagging in the same areas that we were before, Allegheny, Steuben, which has actually improved a little bit. So we're still seeing in our rural counties hesitancy being a big limiting factor. There is a great push both in PR campaigns and in outreach to try to sway those folks towards vaccination, but it's become a much slower process. I will also say, and we'll talk about this a bit more in a moment with the vaccine distribution, we are starting to see a bit of a drying up of vaccine going to hospitals. The state, and perhaps appropriately so, is starting to move on from the idea of hospitals being the primary vaccination site and focusing more of their attention on community pods, pharmacies, and then now, as many of you are aware, physicians' offices. So more of the vaccine is being distributed there. Obviously, with the pause in the J&J vaccine, hospital or pre-discharge vaccination has largely ceased across the region for the moment, with some small exceptions. So we'll talk more about that in a bit as well. But that's where we stand locally. If we go to the graphics, you'll see that we're starting to see a little bit of a rebound, that bottom right-hand corner, as we look at Monroe County hospitalization and ICU. The mortality curve, may be inching up from a plateau, if you will, but certainly hasn't surged again like what we were seeing back in the December, January timeframe. Whereas if you look at the rest of the country, everything is still pretty much at a plateau for the last couple weeks for the moment, which is good. If you go to the last slide, the new cases, you can, well, that's good. We can just go in there. So this is the region. This is from Nick Apostolaris, who shares this with us. And as I said, the regional kind of plateauing, a bit unlike Monroe County, which has had a bit of an incline. You can see that most of our surrounding neighbors are fairly flat at the moment, which is good. So despite the fact that there's potentially more hesitancy in some of these counties around vaccination, we are not seeing any increase in infection rates. And in fact, compared to Monroe County, they seem to be doing a bit better than we are currently, which is great. Hopefully Monroe County will follow suit very soon. Okay, so one thing, the testing there has been, and I think we'll be putting this out today, and this really won't be an issue for long. They've again been moving around the testing sites for asymptomatic pre-surgical testing and the like, but the River Road site has still been the correct place. So there have been a few folks who have been kind of lost looking for where they should go for testing. That largely did not come from any of our practices. So I mention it only to say we will continue to provide you updates if and as the testing location.
Chad, is it just me or can we not hear you?
I can't hear him either.
Oh, I thought I had lost my. You can't see too many faces, so I didn't see any other questioning faces. So. Talk amongst yourselves, please. Well, you're muted now. You got to unmute.
All right. Well, that was fun. So, for some reason, my computer doesn't have a working microphone, and my phone just decided not to play anymore. So, hope everyone had a lovely conversation while I was gone, and didn't read my lips at all the expletives that I was saying while I was trying to log back in. So now we're back to PG version of the COVID call. That's good. Everything that was just said for my neighbors in the office was not apt for children. So we're back, and I apologize for that. I have no idea really what just happened. I don't remember where I was. So testing, we're good. We'll let you know if and when testing sites change. But as I said before, or maybe I did say it, you just didn't hear it, it didn't seem to be our practices that were sending folks to the wrong location. So that's good. Now on to vaccine news. So unless you've been hiding under a rock or just not watching any news or reading any information whatsoever, everyone knows now that the J&J vaccine has been paused. There is strong speculation that it will be resumed with some appropriate warnings as of Friday, but we have not heard definitive answer to that yet. Clearly, anyone who was concerned about getting vaccinated is going to be even more concerned now. And I can only imagine that the convincing someone to take the J&J vaccine is going to be a bit difficult at the moment. Now, a couple things about that. Number one, there was a poll released this morning, I think it was by CNN, that showed that 70% of respondents to the poll actually said that they don't think the pause should have any effect on whether or not they would be willing to accept the J&J vaccine. I don't know where they found that 70% of people, but I can only pray that that is ubiquitous for the entire country. The other piece, as of the time of the pause, there had been 6.8 million doses of J&J administered. There were 6 cases of thrombosis. At least 5 of those were central venous or cerebral venous thrombosis. Now that's extraordinarily rare. There is some now discussion, I think from a German hematologist, that there may be a link between those two. However, all of those cases that I have seen were in women who were on some type of hormonal therapy, either birth control or hormone replacement therapy. So if you have a man who needs vaccination, or if you have a woman who is not of childbearing age and not on hormone replacement treatment of any type, you could probably make a good argument that there's no reason to be concerned about the J&J vaccine. With over 6.8 million doses administered in 6 cases, and none of them in folks who weren't receiving some type of hormone therapy, you could argue that this is almost a blip in the radar compared to the risk of not being vaccinated if J&J was all you had access to. That being said, surprising to all of us, the FDA could care less what I think about that. And so there will be a warning that will be attached to the vaccine that we will find out when and if it is released. So take that for what it's worth. But as we know from before, there was a set of the population who was very enamored with the single dose vaccine. And certainly there is some of the population who there is concern specifically homeless folks who have access to transportation issues, who a multi-dose vaccine may be very difficult to be able to accomplish. So I think we will find, and hopefully, be able to justify that the safety in most of our population will be okay. But we'll find out more when and if that vaccine gets released again. So that's all I have for that. The next thing, I think it was Monday, that there was a study that was released that got picked up by the popular press very quickly that came out of Israel that specifically looked at patients who had received the Pfizer vaccine and showed that there were 8 cases of patients who developed infection with the South American or Brazilian variant of the virus. Now, the insinuation has been made that those patients developed severe disease. The paper was horrible, and it reads really badly, and there's a lot of statistics in it. However, when you really go through it, several things come out. Number one, there were 8 cases. Number two, 7 of the 8 cases were of the Brazilian variant. Number three, none of those cases were moderate or severe disease. All 7 were actually mild or asymptomatic disease who just turned positive on PCR assay. The other piece of it that is not getting picked up is that the rest of the population, and over 50% of the Israeli population, has been vaccinated with Pfizer, because Israel is one of the countries that has done the best about national immunization, has really shown almost no infection and or spread with that. So unfortunately, a lot of media outlets have picked this up and said, the folks who got Pfizer could still be exposed to the Brazilian variant and develop severe disease. That is not the case, at least from that data. And we have not seen that from any data at this point. And in fact, most of the data that we have seen says that even those who do get infected develop no more than mild disease. So that is, if anything, actually reassuring that the one variant that there was concern that Pfizer and Moderna may not be active against, in the minute quantity of patients who were infected, developed asymptomatic to mild disease only. So it got picked up by a lot of news outlets, and unfortunately, I think it's probably conveying the wrong message to many. And I know that some who got Pfizer have been very concerned now, what they should be doing differently. Should they get some type of booster? There's no need for that at the moment. The other study that came out of Israel that almost got no press whatsoever, but is potentially far more important, is that for every 20-point increase in percent of the population that was vaccinated, they saw a reduction by half in the percentage of children who developed COVID. So as we get to this kind of herd immunity status, every 20% increase in the population cuts the number of kids who are not able to be vaccinated developing COVID by half, even though they have no access to the vaccine. So 2 things, that does seem to decrease the risk of transmission. There has been some consideration all along that even that those who do turn positive on, who are post-vaccination, likely carry lower viral loads and may have less risk of viral shedding, so that the transmission rate is actually reduced for the entire population, even for those who do not pursue or become vaccinated. So that one probably has a much greater public health consequence and importance, but has really gotten no press whatsoever. But both of those studies came out of Israel. And of course, the second one wasn't as sexy as the first, so didn't get a lot of story. So that's good news. The final piece that just came out this morning is that there is a new variant. Yay! It is now the Texas variant, as it has only been found in one college student in Texas who was not vaccinated. And yes, anything bad has to come from Texas. It is now the BV1 variant.
We lost you again, Chad.
Oh, God. How's that possible?
Oh, you're back.
Oh, you can hear me now?
Yeah, you're back.
No?
Now I can hear you.
Hey, okay. I don't know what's going on, so I apologize. I'll just do hand signals. We'll do
Actually,
hand
we're just playing a game with you now. We're just going to do that every 5 minutes.
This is a team effort.
We need to get him some Love Actually cards for him to, walk through.
Right. I can just do like the Cards Against Humanity. I can just hold those up and we can act those out. That'll be fun. So this BV1 variant is very similar to the UK variant. The college student who was infected had very mild symptoms. They have not found it in any other samples in Texas to date. However, it was just reported this morning. So it does have mutations in the zones that have been associated with higher rates of spread and more severe outcomes of disease. But obviously, we only have one reported case of it thus far. I only mention it just because it's in the United States. I don't know if it has any other meaning whatsoever, but it does seem to be one that may have a transmissibility issue that is just got brought up. So know that that's the case. Otherwise, I don't think there's much else. I think on the whole from the vaccination, there is a greater and greater move towards, and we're not there yet, but getting towards almost a walk-up kind of access to vaccination because it's getting harder and harder to fill vaccination clinics. The work that's going into identifying patients who need and want vaccination almost is beyond the number that could just say, okay, we've got vaccine available, just show up and we'll get it done. So we'll see if that starts to transpire anytime soon. The other hot issue that keeps getting asked over and over again is when will Pfizer be approved for the 12 to 15 crowd? We have not heard any timeline as of yet. It will likely be at least a couple of weeks, from what I understand at best. But I would, the guesstimate is by the time we get to the end of May, beginning of June, we likely will be in the zone of being able to vaccinate that 12 to 15 crowd. But then for the under 12, it'll likely be beginning of 2022 before we'll have data and or be ready to vaccinate them. Obviously, the hope is that that'll come sooner, but that's good. Those studies are still ongoing at this moment. I think that's really all I wanted to cover. The only other piece that I wanted to bring up for those who hadn't seen or heard yet is for PCP advisory this week. We canceled that. We had a fairly light agenda, so we will reconvene in May, and we should have actually a much more robust agenda by then, which will be good. So just wanted to convey that. And I think that covers everything I've got. So I will shut up and turn it over to LJ.
Thanks, Chad. I just wanted to continue on the vaccine end for a minute. I know that some of the practices on the call have participated in doing some vaccination within their practices for their patients. There's been a lot of hesitancy around that. Obviously, just because of the storage issues, the timeline that you have to follow, that you discern from some of our pediatric practices too, about even though we're used to doing flu clinics and things like that, the wait time that's required, an observation period after a person gets a vaccine, what will that do? So I just wanted to tell you guys that there's a series of meetings that have been happening specifically around pediatric vaccination, thinking about obviously the adolescent population that can be vaccinated now, but then prepping for that expansion of age down to 12, and then, much later when it goes down to the babies. And so the conversations have really started to gel that it needs to be a multi-pronged approach, particularly where there is vaccine hesitancy or mistrust. For many families, it's going to make a difference for them to be able to come into their trusted healthcare provider team and have a conversation and potentially get the vaccine there. At the same time, it's not feasible to think that that's what's going to make all of the difference in reaching, the children and families that we need to reach. So I think multi-pronged approach is leveraging processes that will work in primary care, where you're not necessarily getting a huge distribution of vaccine that you can't manage, but it's a smaller distribution of vaccine. The other piece would be working with schools and community centers and other places where kids are to be able to deliver some of the pop-ups or other sort of targeted clinics. And then obviously still utilizing the the state sites, the county sites, the other venues where vaccine has been given. So the county reached out to us just late yesterday to let us know that they have a large distribution of vaccine. And we are going to put this in our messaging today. There is a key pharmacist that practices can reach to. They've had some success in doling out a vial or two of vaccine to a primary care practice for them to be able to utilize for their patients to connect with them. And that has worked well. I will just say right now, our team at AHP are not the experts in this, but we want to make sure we make these connections so that if you're ready to do this or you have questions about it, you can contact the county and find out. It would be a chance to be able to get some of your 16-year-olds and up who haven't been vaccinated yet, or people who have had some vaccine hesitancy that you want to meet with, talk with, and then have opportunity to be able to give the vaccine. So we will give you that connection and that information. And then I think stay tuned in terms of more plans about how things may happen. I know there's been some school site vaccination that has occurred with Webster schools, working with acute kids. I know some of the urgent cares are thinking they might be able to provide some of that opportunity for vaccination as well. I think we all got to be in on this together. Not every practice is going to want to do this in their practice, but we've got to be mindful of these different strategies we can use. And the last thing I wanted to point out to the PEDS practices specifically is it is okay for the practices to vaccinate adults as well as kids. So this is what we have heard from the county is you could vaccinate the children and their parents. So that's another way of being more efficient, I think, reaching more people and not having that concern about vaccine waste. So we will send you the contact information for reaching to the county. And I think my hope is that we have figured out a very good, effective, multi-pronged strategy by the time we're ready to start immunizing lots more kids and not be scrambling around at the last minute. So we're trying to work on those pieces now. So if anybody is particularly passionate about this or interested, want to be able to join one of the groups that's meeting to talk about this, please send me an email. I'd be happy to get you invited to a meeting. I think having our independent primary care practices represented in those conversations is really key. Irondequoit PEDS will be representing primary care in the meeting that is happening on Friday, as well as some of the other practices within the system. So just let me know if you want to be in that. You can put it in the chat if you want, or you can just email me separately. And I think the only thing I wanted to tell folks is there's a whole lot of inconsistency that's happening around screening for symptoms, assessment for symptoms, using rapid antigen versus PCR testing for symptomatic patients. I just have to say, for having established a pretty nice community standard that we adhered to for a long time, I think there's just a lot of other stuff going on, and many of you are reaching out saying, what is going on? Has the guidance changed? We're convening a meeting on Friday with the schools reopening task force to try to better understand what's going on and try to create at least a little more guidance around what we really do think community standards should be now, so that we are all at least rowing in the same direction, because we're confusing families, we're confusing schools. There's a lot of irritated folks again now feeling like somebody's not following the rules and somebody else saying, well, no, those aren't the rules. So on Monday of next week at 7 o'clock, there's another one of those schools and healthcare community forums that's happening, an evening session. The County Health Department and Mike Mendoza will be on, Brenda Tassini will be on. I am moderating that section. There will be representatives from school health as well as from primary care. George Porter is going to try to join, or at least give me some data around the myocarditis assessments. And so if you want an update on where things stand by Monday at 7, I hope we've got a little better, clear direction again. It just feels like we gotta rally again, because we are seeing more cases in kids and teens. And if we don't get our act together, we're going to have more problems, I think, again. That's it for me.
Beautiful. Renee, do you have anything else?
I do not.
Okay. One of the things I wanted to mention that several folks have reached out to me about is about the monoclonal antibody infusion for the mild, moderate ambulatory patients. So it does exist in Rochester. It is just kind of getting started. They're only doing 3 patients 3 times a week. They've only got it set up at the moment for Epic-based referrals. but I did talk to the person who is overseeing that, and they are going to start working on, and I will continue to aggravate them, a way to get referrals from outside of Epic to do so. Again, remember so the monoclonal bepirovirab was just pulled off the market. It's only the single antibody cocktails was not found to be terribly effective. The multiple antibody cocktails still has some relevance, but only, and to my understanding, unless it's changed, in patients with mild or moderate disease who are not hospitalized, who are within 4 days of diagnosis. So it's a really small contingent of patients and a relatively short window of opportunity to get them referred. Most of those folks are not, it's not a huge gangbuster improvement, but it is available now in the community, but it's really just getting up and going. And as we get more information about how we can refer from the community in for this, it's been done at Strong at the moment, but a fairly limited quantity of, like I said, 3 patients 3 times a week at the moment. So more to come on that, but several folks have reached out to me about it in the last week or two. So I just want to make sure that I close that loop on that particular discussion. And I think with that, I do not see anything else in the chat room. So if folks have questions, speak now or chat away, because probably my phone's going to kick me off in about 3 seconds. All right, I'm not seeing any coming off of mutes or any chats going live, so we will wrap it up. For now, we will plan to see you back in 2 weeks' time, so it'll be May the next time we see you. If it's still snowing at that point, I will probably jump out the nearest window, which, if anybody likes me, I'm on the first floor, so it's probably safe. But I'll see if I can find a higher window by that point. So have a lovely day, everybody, and we will see you.